Okay. Good afternoon, everyone. I'd like to call to order the Senate Committee on Health and Human Services for March 11th at 3:31 p.m. We were close. I'll go ahead and start with a roll call and note that myself, Senator Spearman, Vice Chair Spearman, Senator Harris, and Senator Kiekever are present, and that Senator Hardy is presenting a bill in another committee, but will join us shortly. So please do mark him present when he arrives. Just as a reminder, we've been in virtual world for a while now. We are still have the building closed to protect the safety of the public and our staff. But there are lots of ways to participate. So if you haven't been able to access that information yet, please Google Nevada Legislature. That'll get you onto our website. And there's a help bar on our website that will tell you about sending in written testimony, registering to testify for this meeting or other meetings, using the opinion poll, or of course, you can always reach out to your senators through email or phone call to their office. We are going to be hearing two bills today. I want to express my gratitude to Senator Orenshaw for bringing us two bills that are related to children. This just happens to be Children's Week at the legislature, so we are happy to hear these bills today. Of course, we care about children for 17 weeks long, and even perhaps when we're not in session, but we did want to highlight these bills this week during Children's Week and want to thank all of the advocates who have been doing a lot of work to raise awareness about issues that face children during this legislative session. So with that, I am going to go ahead and open the hearing on SB 146 and invite Senator Orenshaw to the virtual dais to present Senate Bill 146.
Thank you very much, Chair Ratty and members of the Senate Health and Human Services Committee. Appreciate you hearing both these measures this afternoon. For the record, my name is James Orenshaw. I represent State Senate District 21. That's parts of Henderson and unincorporated Clark County. With me today, I have Amy Honadell, a children's advocacy attorney at the Legal Aid Center of Southern Nevada. I'm privileged to know Amy and actually work with her. We have both represented the same clients at different times in juvenile court. Also, I have Bailey Bortolin with the Coalition of Legal Service Providers. With your permission, Chair Ratty, I will give some brief opening remarks, and then Ms. Honadell will tell you more about the need for this legislation. Please note that we are working off the proposed amendment, and I would like to thank all of the stakeholders that assisted in ensuring this language is the best it can be, including the Department of Child and Family Services and the Clark County Department of Family Services. We have some experts with us today who can help answer questions. Senate Bill 146 seeks to codify best practices for coordination and communication when practicable between the treating team for a youth's mental health and the receiving team that is treating the child if and when that child is in a temporary crisis. These children undoubtedly experience trauma, and so many of these children have mental health needs, diagnoses, medications, and plans already in place. Unfortunately, sometimes things can get worse and a child experiences a temporary crisis. And unfortunately, that information is not always relayed as to past treatment plans and what's already in place. What might have helped talk the child down or inform the care and treatment plan of the child may be left out of the conversation. When that child is released from a facility, oftentimes there are new diagnoses, medications, and plans that are different and possibly in conflict with the original treatment plan. The intent of this legislation is not to hamstring providers or reduce access to emergency care in any way. We want children to receive the treatment they need, and we trust the professionals that are treating them. But we believe that codifying the best practices of an informed and warm handoff and consultation could make a world of difference for these kids. With that, and with your permission, Chair Ratty, I'd like to turn it over to Amy Honadell to share some of her experiences as a children's advocacy attorney around this issue.
Please go ahead.
Thank you, Chair Ratty and members of the committee for allowing me to speak on Senate Bill 146 and the amendment that is being put forth. I am Amy Honadell, last name is spelled Honodel. I am a staff attorney with Legal Aid Center of Southern Nevada in the Children's Attorneys Project. I represent about 100 foster kids at any given time, so this issue is near and dear to my heart as well as to my clients. I submitted a written statement in support of Senate Bill 146, but I would like to outline the bill with the amendments for the committee briefly. The first section, Section 1, is requiring admitting staff at a locked mental health facility to reach out to a child, a foster child's main mental health treating provider after asking whoever brings that child in if they have a treating psychiatrist or a main treating provider. It requires the staff to make reasonable efforts to reach that person. If they are able to reach that person, then Section 2 requires the admitting staff of the hospital to make reasonable efforts to coordinate care with that main treater, the person who sees the child on a regular non-emergent basis, and also consider input from that treating provider in determining the level of care that child will receive while admitted to that locked inpatient facility. Section 3 of Senate Bill 146 then requires the staff at the admitting facility to seek consent from the legal custodian of the child, and also to talk to the child and get the child's assent or agreement to coordinate care while in the hospital with the child's team of mental health care providers on the outside. In the time that I have been representing children, what has become quickly apparent to me from a qualitative observational standpoint, as well as in my education on child welfare law and practice, is that number one, youth in foster care have a significantly higher rate of diagnoses of mental health care problems than our general population. And I was reading an article recently that said it's 80% of the foster care population has mental health care issues that need treatment, versus 18 to 22% of the general population. What makes it difficult for our population in coordinating care, unlike a child who may be in a one-parent or a two-parent household, is that our population is transient. And when I say transient, I'm talking about moving between placements as we try to get them to their forever homes or with family, as well as who the caseworkers are who are advocating or representing these child through the various child welfare agencies in the state. Also, there's a somewhat diffusion of authority in that we have multiple providers, we have a child welfare worker, we have attorneys, and we have the court overseeing what happens to this child. So it makes care coordination particularly difficult. And this bill is not intended to undercut what the mental health providers we have here in Nevada do. Rather, it's really to get them to start coordinating care. When the care is better coordinated, then the outcomes are better for our foster youth. And I think many of us will agree that we need to improve the outcomes for these kids. They are at significant disadvantages. So I want to tell you two stories, and these are the stories that are set forth in my written statement that are submitted about clients I currently have on my caseload. So I'm using pseudonyms for them. They're younger kids. One is Caden, and Caden is a 10-year-old. I wasn't his original attorney, but this kid is smart as a whip and can beat me legitimately at several games, including Connect 4. But Caden's been in care for about 4 years. He came in with 4 siblings. His siblings are in their forever home. Caden is not. And let me tell you why he's not in his forever home. He has intense anger, and when he has an outburst, he will try to hit and kick things. He'll knock over furniture. He will yell and scream. And it can be scary, and it's definitely memorable as I have seen them. But when these occur, he's 10, he's not that big, but it's enough that under our child welfare law, Nevada Revised Statute, Chapter 432B, that Caden can be admitted to one of these locked facilities. And I think he's been admitted more than 10 times since he's been in care. But when he goes to those facilities, they're scary, okay? He doesn't get to take his own clothes. And if he does have his own clothes, he doesn't get to take anything with strings or wires. It's a strange bed, strange people, it's noisy. And he'll see a doctor, and it's usually not his doctor that he's had since the beginning. One thing I can say about Caden's treatment team is that involves a person who prescribes medication. He is a therapist who is very invested in his well-being and is trying everything within his means to help Caden be able to make it through these outbursts without hurting anyone. He has myself and a couple other workers who are really dedicated to him. But when he's in this hospital, none of us are there with him. So one particular time, we had been fortunate enough to identify a relative who would take Caden and wanted to adopt him. And this person was very new to the mental health care world and didn't understand a lot of what was going on. Caden had an outburst. He was admitted. And when he was discharged, he was given a new prescription by the doctor inside the hospital, and that was not communicated or transmitted to the rest of the team. So he left essentially without medication that he had been taking while he was in. And this disruption in his care actually led to a more intense outburst, at which time the uncle said, I can't take him, I can't adopt him. So right now, Caden is in a congregate care facility without an adoptive resource at age 10. And it seems that the only way that this young man, this boy, will find permanency is if we can get this care addressed. Now, on the flip side, I have another client, Sarah, and who is very close to being in her forever home. So this is a good story for her. But at one point in time, she was with a relative placement and did not want to visit with her biological father. She threatened to cut herself, and that is, while it's not a suicide attempt, it is enough to get her admitted to one of these inpatient facilities. Now, in this particular case, I had been coordinating with her therapist, the person she sees on a regular basis, about this visit with a dad. And when I heard that law enforcement was on their way out to Sarah's placement to take her through the system to be admitted, I reached out to the therapist and said, hey, I don't think this is serious. I think this is some influence from some adults. Can you please get involved? And the good news is that Sarah was not admitted. Between the therapist advocacy, the emergency doctors who were looking at her, they decided that this was more of a statement of an 11-year-old being dramatic and not a threat of self-harm. So the good news was she did go to that visit. She wasn't admitted to one of these facilities. So really what we want with this bill is to start we want to make a foundation for a dialogue between the mental health care providers that deal with our foster youth. They don't have a parent, they don't have a mama bear there to fight for them. They have a caseworker, and sometimes it might be an on-call worker, it might be a foster parent who doesn't know them. So we want the medical professionals to start communicating, to work together so that we can get really good outcomes for these youth in the least restrictive settings. It's not in any way intended to undermine or any way limit the hospitals. We just want to bridge a gap. And I thank you for allowing me to address this.
Thank you very much for sharing your testimony. Senator Orenshaw, is there additional presentation of the bill?
Your Honor, I believe Ms. Bortolan maybe has some brief comments, and then I'm happy to answer any questions.
Great, thank you.
Thank you, Bailey Bordelin, for the record with Nevada Coalition of Legal Service Providers. I'm just here to answer questions as well, and I would note that DCFS is with us on the Zoom, including Dr. Raven from Public and Behavioral Health, who has helped draft this language and can speak to some of the medical terms of art in it, should you have questions around that. I was looking forward to having him here for Dr. Hardy's questions, but maybe he'll join us during. And then Bridget Duffy is also here with the Department of Family Services. So I think our conversations have led to what looks like a scary amendment, but is really good language that everyone agrees fixes a problem and codifies a best practice that could make a big difference for our kids. So thanks.
Okay, great. I'll go ahead and open it up to the committee first for questions. You can use your virtual hand or just wave at me. I can see you all right now. All right, I see no virtual hands or wavings, but I do have a couple of questions that I'd like to get on the record just to make sure they're clear. So first of all, could you comment on whether it sounds like from your testimony that this is intended to only be for inpatient admitting? So not necessarily if I have an outpatient plan of care or an intensive outpatient plan of care or anything along those lines. So is that that accurate? Is this really only intended to be for when a child is being admitted into an inpatient facility?
Thank you, Chair. Again, for the record, this is Amy Hanadel. Yes, it's only to be used for inpatient admission into a locked facility. And while I don't see the wording in there for emergency or unplanned, I would submit to the committee that that would be the only time it would be used. When we do have planned admissions, we have a separate procedure in NRS 432B to make a request to the court for a court-ordered admission. So this would be for those times when it's exigent circumstances. So yes, thank you.
Narrowly tailored to an emergency or unplanned admittance into an inpatient facility.
Correct.
Great, thank you. And that was Amy Hanadel for the record. And then other, just for the record question, when we say other healthcare providers, it looks like there's some narrowing language where in the subsection 1, or in section 1, it says, or another healthcare provider authorized to diagnose and treat mental disorders. But could we be very clear about what healthcare providers we're talking about?
Thank you, Chair. This is Amy Hanadel again. I'm going to defer this to Dr. Rabin from DCFS, but from the legal advocacy standpoint, this would be someone who is qualified to diagnose a child with either an emotional disturbance or a mental health disorder. So we're looking at psychiatrists, psychologists, to the extent that certain levels of therapists, depending on their training, can make or suggest a diagnosis, we would include them, but this wouldn't be the social work interns working under supervision. We're looking for someone who has a rapport with the child, who's familiar with the treatment, has the requisite education and licensure to do that. Thank you.
Could be like, and perhaps Dr. Raven, you'll comment on this, but an APRN with a emphasis in behavioral health, perhaps.
Correct. And this is Amy Hanadel again. And my client, Kaden, actually does see a nurse practitioner over supervised by child psychiatrists to diagnose and write medical prescriptions. And she does have a good relationship with my client. So it would include her, a person like her. Thank you.
We just want to make sure we get it drafted correctly to be inclusive of the folks that would make sense. So Dr. Raven?
Good evening, good afternoon. Chair Ratty and members of the committee. For the record, this is Dr. Leon Raven, spelled Leon Ravin. I am statewide psychiatric medical director for the Division of Public and Behavioral Health. Thank you for the opportunity to consult on the language of this bill. And to your question, Senator Ratty, the scope of the individuals who could provide input to the inpatient treatment team should include all the professionals who are primarily responsible for diagnosing and treatment of the child in outpatient settings. So most commonly there would be a psychiatrist, but also we have to recognize that a number of children receive care from providers like advanced practice registered nurses, since they received the legal right to practice as a licensed independent providers without supervision or collaboration. It is my understanding that with the permission of nursing board, they can practice within the scope of psychiatric mental health when they have appropriate credentials and qualifications. In addition to that, there could be a physician assistant, for example, who practices under the supervision of a psychiatrist. It could be a primary care provider, because we do need to recognize that many individuals receive help for their psychiatric needs from primary care family physicians. So those could be included as well. And in cases when a child is not in need of psychotropic medications, it is foreseeable that a psychologist would be the primary healthcare provider for the child for his or her mental health needs.
All right, so I heard, thank you for the answer. So I heard psychiatrists, APRNs, physician's assistants, primary care doctors, psychologists. What about licensed clinical social workers or licensed family therapists?
Thank you, Senator Ratty, for this question. Again, it's Dr. Leon Raven for the record. I can only comment for the scope of the disciplines that are authorized to prescribe medications. I cannot speak on behalf of the mental MFTs, marriage family therapies, or other licensed clinical counselors. However, I would like to emphasize that since the professionals are expected to provide substantive input to the inpatient treatment team to the extent of need for inpatient hospitalization, I imagine that should be professionals who are typically authorized to have admitting privileges to inpatient psychiatric services. And usually there would be either physicians, physician assistants, or advanced practice registered nurses.
Okay, so we're going to have to drill that down and really make sure what we're understanding that the amendment wants to include is, so if it is just people who have admitting privileges, or if it is any behavioral health care professional who's already connected to this child who might have input, if we could get some feedback on the intent of where you really want that to land, I think we'll need some help. I think our challenge is that another healthcare provider authorized to diagnose and treat could be psychologists and licensed marriage and family therapists, licensed clinical social workers. So I'm not sure if anybody else is able to comment on the intent, but before we work session, we'll want to get to that.
If I may add, this is again Leon Raven for the record. I think that it may make sense to split the professionals into two categories, since Section 2 primarily focuses on determining the level of care for the child, which is whether or not to admit the child to the most restrictive settings of inpatient treatment facility or continue treating the child in outpatient settings. That's where you may need a professional who is at the level of qualifying for having admitting privileges to the hospital, but for the ongoing coordination of care and discharge planning, any mental health professional who is primarily involved in treating a child for mental or behavioral health issues should be included. So I certainly foresee possibility of splitting that into two categories. Thank you.
And that makes sense to me if continuity of care is the goal wherever they are already connected to care. So, okay. Sorry, my apologies, Senator Harris. I think I missed seeing you on the front end, but please go ahead.
Thank you, Chair Ratty. No apologies needed. I was a little late getting to the reactions button. So I have a couple of questions, if that's okay. My first question, is that all right, Chair?
You kind of broke up when you were asking if what was okay.
I have a couple of questions, if
Please
that's
go
okay.
ahead.
Thank you so much. So my first question is, why are we limiting this to children, juveniles who are under the jurisdiction of the juvenile court? I know that those are the children that legal aid often interacts with, but are we seeing this gap with other children as well?
Bailey Bordelin for the record. So that's a great question, Senator. When we first started having these conversations with some of the treating doctors that we often work with in the 432B context, and we were identifying the problem, right, of our kids already have diagnoses, they already have medications, and they come out with a whole different set, and could we try to coordinate that care? We were told, well, yeah, that's a best practice. That's a best practice that should be happening. And so when we were told it was a best practice, we thought that the gap was probably specific to 432B. And so we wanted to solve the problem for our clients. I can't, with any firsthand knowledge, speak to what is happening in other places, but I will say in the last day or two, we've gotten some feedback that it may make sense to broaden this, and that just wasn't the angle we were coming from. And I think Dr. Raven could speak to that as well if you'd like to.
Thank you, Senator Harris, for this question. Through Chair Ratty to you. I do agree that the same level of collaboration constitutes good clinical practice across all ages. And overall, as a practicing physician, practicing physicians, we should not be making the determination on the scope of care provided or the level of coordination just based on whether or not the child has parents or is in foster care or is in any other facilities, as well as even if the person is an adult, we still should strive to maintain the best collaboration between inpatient and outpatient providers.
Chair Reddy, if I could jump in through you to Senator Harris. Certainly,
Please go direct.
Thank you, Chair. Certainly, when we look at trying to fix a problem, and I think the question comes as to the scope we're going to look at with the legislation. But in my experience practicing in the delinquency courts, not in the abuse and neglect sphere, certainly I've heard from parents who felt frustrated when a child was, let's say, committed to a state correctional facility. They'd had a treating psychiatrist before here in the community and felt that, maybe there was a real disconnect between the care plan prior to the child being committed, not to a mental health facility, but to a correctional facility. So that's anecdotal. I don't have studies as to whether that's an issue, but anecdotally, I certainly have observed that in terms of continuity of care and whether the treatment at the facility, even if it's not a mental health facility, is really, if there's a disconnect between the treatment plan before.
Well, I would certainly support helping as many children as we can with this bill, if that's something you all are interested in taking on. So my next question is about the language in subsection 1 versus the language in subsection 3, and this may just be a minor drafting. In subsection 1, we refer to a treatment facility or other division facility for inpatient psychiatric care. And that seems a little bit broader than the language in subsection 3, which is just an inpatient psychiatric treatment facility. And so I don't know if those two sections should be, congruent. Or if there's a reason why it's a bit more broader in subsection 1 than in subsection 3.
Bailey Bordelin for the record. Thank you, Senator. You are right, and drafting and your lovely, wonderful committee staff has noticed that issue as well, that just got lost in translation of all of the stakeholder rounds we went through on this amendment. So the Department of Family Services, Clark County, requested that section 3 narrowing to inpatient psychiatric treatment facility, and we would now go back and mirror that in section 1 and just missed that.
All right, thank you.
Senator, I'm going to just follow up on that one quickly because we need it for the record as well. So the intent of the bill is to only apply to inpatient psychiatric treatment facilities. Is that correct?
Bailey Bordelin for the record. Yes.
And is that only DCFS facilities, or would that be a private facility as well?
I'm going to defer the question to Amy to speak to if both types are used in 432B. I can't answer that.
And that's kind of our question, because 433 is relatively specific to DCFS facilities as opposed to private facilities.
Thank you, Chair. For the record, this is Amy Honadell answering this question. It's intended to apply to both, which may be the reason for the conflicting language. Our youth down in Clark County are admitted both to state facilities, and we have a few private facilities that are taking them on an inpatient basis.
Great. Thank you
Thank
for
you.
the answer. And thank you, Senator, for letting me butt in there to make sure we got to the very pointed question that our legal counsel needed. So please go ahead, Senator Harris.
Okay, I promise this is the last one.
No, you're fine.
In subsection 1, there's a change from before to when. Can you tell me a little bit about why that change was made and what when means, if not before?
Bailey Bordelin for the record. I will let Bridget Duffy jump in here as well if she wants to, but some of the concerns was just from a practical standpoint. I think legally we agree with you, but practically speaking, we thought before had more of a connotation of you can't do this unless, and we wanted to make it abundantly clear that this was a when practicable, but should not be seen as a basis for denial. And Bridget, I'll let you jump in if that didn't quite cover it.
Yes, good afternoon, Chair Ratty and members of the committee. I am Bridget Duffy. It is BRIGID DUFFY. I'm the Chief of the Juvenile Division for the Clark County District Attorney's Office. And I'm here today on behalf of Clark County Department of Family Services. That is like a super long title. Senator Harris, it was the Department of Family Services request to change the before to when, specifically for what Ms. Bordelin had expressed. We sometimes have difficulty when our children are continually cycling into these acute episodes for emergency treatment. We have very limited providers, especially when you get down to some of our younger age children, as Ms. Hanadel represented with her clients that's age 10. And so we wanted to ensure that we weren't closing opportunities for our children based upon facilities saying, well, we couldn't reach the treating healthcare provider, so we cannot admit this child for this emergency treatment because we were unable to admit. We were afraid of how that might be interpreted at 3 o'clock in the morning by a staff of a hospital. And so we thought that it would be much more clear for everybody to understand that it's when you are admitting a child, you need to make those reasonable efforts to contact that healthcare provider.
And Ms. Duffy, is there some type of, I guess, time limit that's reasonable, within 48 hours? Or, I've noticed the change at the bottom where it says make reasonable effort. And so that alone seems like it would address your concerns even without changing from when to before. But, is there something where we could put an actual requirement that this reasonable effort be made within a certain amount of time, as opposed to, I guess, leaving it kind of open?
Yes, Bridget Duffy for the record. Thank you, Senator Harris, for that question. Actually, I don't disagree with you. I think that the reasonable efforts was the recommended language of DCFS, and I honestly had put some time frames on there. I don't know if I put the best time frame on there, but like you, I agree that there should be some sort of no later than. But again, we're all working to compromise to come up with the best bill possible. I don't work in the field of psychiatric treatment, so I was going with the experts that from our DCFS partners. But I do understand your concern.
Dr. Raven, would you like to comment on that?
Chair Ratty, if I may, this is Leon Raven for the record. I would like to say that from the medical perspective, it would help not to have a specific cutoff line, a deadline on how long the treatment team should try or at what point they should continue making efforts as opposed to not to. The considerations are that if a child is brought to the facility on Friday night, then the outpatient provider may not be available for his or her input until Monday morning. And if we say that the inpatient treatment team should seek that input no later than 24 hours, let's say, or no later than 12 hours from the time of the admission of the child, then we are risking a possibility that they will try to seek that input only for the duration of time outlined in the language of the bill, and after that they'll just put an entry in the chart saying that they tried and they got no response, and at that point that would be the end of their efforts. From the clinical care perspective, it would make sense for the treatment team to continue seeking that input and coordination of care with outpatient team for the entire duration of the treatment. And even if the efforts for whatever reason were not successful during the early hours or days of treatment, that they will continue doing so for the duration of the treatment episode. Thank you.
Thank you for the indulgence, Chair.
Any additional questions from the members? Senator Hardy, before you arrived, Ms. Borderland said she was very excited to have a doctor here to answer your questions, and you have disappointed her without a single question. Just want you to know.
Sorry.
Okay. All right. It sounds like we're in good shape here. So we'll go ahead and move on to those who would like to testify in support of SB 146. BPS, if you could help us open up the line.
Thank you, Chair. Callers, if you'd like to testify in support of Senate Bill 146, please press star 9 now to enter your place in the queue.
And BPS will limit to 3 minutes.
Thank you, Chair. Will the caller with the last 3 digits of 377 please slowly state and spell your name for the record? You will have 3 minutes and may begin now.
Deshaun Jackson, DASHUN JACKSON. Good afternoon, Chairwoman Ratty and committee members. My name is Deshaun Jackson, and I currently serve as the Director of Children's Safety and Policy with the Children's Advocacy Alliance. The Children's Advocacy Alliance supports Senate Bill 146. We believe this bill promotes the mental and emotional health of a child. The Children's Advocacy Alliance also recognizes the trauma a child goes through when they are placed into a facility and removed from their home. This bill allows a continuity of care while preventing a child from being over-medicated and reducing the trauma caused to the child. Lastly, this also allows and promotes youth having a voice. Thank you all so much.
Will the caller with the last 3 digits of 318 please slowly state and spell your name for the record? You'll have 3 minutes and may begin now.
Good afternoon, Chair Ratty and members of the committee. This is Kendra Birchie, KENDRA with the Washoe County Public Defender's Office. My office represents parents in those 432B actions, and we support this bill. We appreciate the Senator for bringing forward this important issue to ensure that there's continuity of care for children. I'll just add that I previously worked as a children's attorney as well as handling the docket specifically for child commitment hearings. And I would agree with the statement that this can be extremely traumatic, and we are preventing potentially future harm on these children by allowing for there to be that continuity of care. Thank you.
Will the next caller with the last 3 digits of 742 please slowly state and spell your name for the record? You'll have 3 minutes and may begin now.
Good afternoon, Chair Ratty and members of the committee. For the record, my name is Jimmy Lau, spelled Jimmy, last name Lau, with Ferrari Public Affairs, representing Dignity Health St. Rose Dominican, which operates 7 acute care hospitals in Southern Nevada. Continuity and coordination of care is an important component to the overall improvement of health outcomes, especially for those in our community who are most vulnerable. We thank Senator Orenshaw for bringing forward this legislation and are happy to support his effort to enhance continuity and coordination of care for at-risk children. Thank you, Chair Ratty and members of the committee, for your time and consideration.
Chair, at this time, there are no more callers wishing to testify in support of Senate Bill 146.
Thank you very much. Let's go on to those who'd like to testify in opposition.
Senator Ratty, sorry to interrupt. I think Bridget Duffy would like to testify in support as well.
Oh, I apologize. Bridget, go ahead. I'm sorry. Ms. Duffy, go ahead. You are on mute, Ms. Duffy.
Oh, thank you, Chair Ratty and members of the committee. I understand. I was called in before I got to put my official support on the record on behalf of the Clark County Department of Family Services. I will spare you my long title again, but I'd like to thank Senator Orenshaw, Legal Aid Services, and Dr. Ravin from DCFS for working with the child welfare agencies to address our concerns with the original language. We support the policy of ensuring that we are coordinating mental health care for our children in foster care. Our children often come with complex levels of trauma and are in need of consistent treatment. When times occur that a child has an acute episode and needs an emergency placement in a psychiatric treatment facility, it is important that the people on the outside or the ongoing healthcare providers who have an established relationship with our children and the acute inpatient psychiatric care provider are communicating. It is best practice and it is in our children's best interest. Senator Harris, I also want to say I loved your question. I work closely with CCSD and I sit on many boards and commissions that address children's mental health, and our kids are suffering on many levels throughout this pandemic. You have all heard, I'm sure, that 23 Clark County School District children have committed suicide this past year, and this is a crisis that is impacting them. Not just foster kids, but all kids across Nevada. So thank you, Senator Harris, for recognizing that, and thank you, committee, for allowing me the opportunity to testify in person via Zoom to support this afternoon.
With that, BPS, would you go ahead and open it up for opposition testimony? Those who'd like to testify in opposition to SB 146.
Absolutely, Chair. Would you like to limit it to 3 minutes again?
Yes, please.
All right, callers, if you'd like to testify in opposition to Senate Bill 146, please press *9 now to enter your place into the queue. Once again, if you'd like to testify in opposition to Senate Bill 146, please press *9 now. Chair, at this time, there are no callers wishing to testify in opposition to the bill.
Is there, now we'll go ahead and open up testimony in neutral. Do I have anybody on the Zoom who needed to testify in neutral? Okay. I don't see anybody, so going, let's go ahead and open up the phone line for anybody who'd like to testify in neutral.
Thank you, Chair. Callers, if you'd like to testify in a neutral position for Senate Bill 146, please press *9 now to enter your place in the queue. Once again, if you'd like to testify in a neutral position for Senate Bill 146, please press *9 now. All right, Chair, at this time, it appears no callers are wishing to give testimony in a neutral position for Senate Bill 146.
Okay, thank you, BPS. Let's go ahead and take it back to Senator Orenshaw. Do you have any closing comments?
Chair Ratty, members of the committee, thank you for hearing the bill. I really appreciate all the support, all the stakeholders working together on this measure. I have taken to heart this committee's suggestions in terms of trying to come up with a little more detail as to definition of healthcare provider, and to Senator Harris's comments about whether the idea here should be expanded for other children. And I'll go back to the stakeholders I'm working with and see if we can work on those issues. Thank you for hearing the bill.
Okay. Committee, any additional clarifying questions before we close this hearing? I do not see any. All right, I'm going to go ahead and close the hearing on SB 146 and open the hearing on SB 158 and invite Senator Orenshaw to the virtual dais again.
Thank you very much, Chair Ratty, members of the committee, for hearing Senate Bill 158. I'm still James Orenshaw. I still represent State Senate District 21, parts of Henderson, unincorporated Clark County. And during the last interim, I was very, very lucky to chair the Interim Committee on Child Welfare and Juvenile Justice. It was a great honor and a privilege, and I certainly want to thank Majority Leader, the Assistant Majority Leader, Legislative Commission for giving me that opportunity. We were able to have 8 meetings. We had 2 in-person meetings before the pandemic, and then our remaining 6 meetings were all held virtually. We came up with many recommendations. We did a lot of work, really commend the members and the staff. Tremendous work went into this committee, the interim. We came out with 10 recommendations for legislation. I believe they either all passed with bipartisan unanimous support or nearly all passed. There might have been a couple where we didn't, but I thought that we really came to concur on many of these issues. And Senate Bill 58 is one of those bill draft requests. And I'm lucky to have some experts here who work in this area from Legal Aid Center. And with your permission, Chair Ratty, I'd like to turn it over, I believe, to Mr. Patrick Hirsch, representing Legal Aid Center of Southern Nevada, and Bailey Bortolin, Coalition of Legal Service Providers, to discuss this legislation and the Kinship Guardianship Assistance Program. There is an amendment which should be on Nellis. We worked with Ross Armstrong of the state of Nevada and other stakeholders on that, and I believe that we've got something that will be beneficial for the state and for our children. And with your permission, Chair, I'd like to turn it over to them and then answer any questions after they're done, if that's okay with you.
Absolutely. Mr. Hirsch?
Thank you, Senator, and good afternoon, Chair Ratty and committee members. I've submitted a written statement supporting SB 158, and I don't want to belabor those points here, but I would like to highlight one particular issue that this bill addresses, and then provide a little context for the bill overall. The issue I'd like to highlight is the way our current laws eliminate the ability of our child welfare agencies to use their discretion. The way Nevada's law is currently written, it completely disregards the professional opinion of our child welfare caseworkers, the ones that we entrust with the welfare of Nevada's children. Currently, it doesn't matter if the responsible child welfare agency is recommending guardianship as the best possible outcome for the child. If return to a parent or adoption is a possibility, the KinGap guardianship program is not available to Nevada families, regardless of the input of our trained caseworkers. To illustrate a little bit more about the need for this bill, please let me tell you about a client I'm currently representing. I'll call him Tommy. Tommy, his father has never really been a part of his life. We don't really know where he is. Tommy's been raised by his mother, and they are very closely bonded. But Tommy's mother is an alcoholic. She's been in recovery for almost a decade, but recently she had a relapse. She's trying, but she hasn't been able to get her sobriety back yet. Now, Tommy's only 12 years old, and in Nevada, that's not old enough to have the right to consent to or withhold consent to his own adoption. But he does not want to be adopted, and he'll tell anyone who asks. He's made that very clear. It's his therapist's professional opinion that an adoption would probably not be in his best interests. Right now, Tommy's living with his maternal grandparents, his mom's parents. And all of them are holding out hope that mom will get her sobriety back. The grandparents could adopt Tommy, but they don't want to. If they did, they would have to terminate their own daughter's rights and take her place. And doing so seems to close the door on her instead of offering the hope and the help that they want to. Now, under Nevada's current laws, the fact that they could adopt means that Tommy's grandparents are not eligible for a guardianship through the KinGap program. It doesn't matter that Tommy doesn't want to be adopted. It doesn't matter that they don't want to adopt him. It doesn't matter that an adoption will probably cause harm to Tommy's well-being. And it doesn't even matter that the responsible child welfare agency is recommending guardianship instead of adoption. Because an adoption is possible in this case, the KinGap program is not available to Tommy's families. And the consequences of that are very real. Without the KinGap program, the grandparents really have 2 options. They can either accept an unsupported guardianship, which will strain their finances late in their life just so they can provide for care for their daughter's child. Or their alternative will be to adopt Tommy, And that will get them a little bit more financial security through adoption subsidies. But they'll have to know full well that doing so terminates their own daughter's rights to her child and also probably will cause harm to their grandchild's well-being. And it doesn't have to be this way. Tommy's family isn't facing this choice because Nevada made a decision that relative caregivers are somehow inferior or less deserving. On the contrary, Nevada's law is very clear on this point. Our relatives are the preferred substitute caregivers. Instead, the reason Tommy's family is facing this choice is because Nevada's kin gap guardianship regulations are stricter than they actually need to be. And SB 158 fixes that problem. Thank you very much for hearing me today.
Thank you, Mr. Hirsch. Ms. Borderland, do you have additional comments?
I can always talk. Bailey Borderland for the record. Thank you. I think you all see before you, it's a very short and simple bill. The language that's being put in the amendment mirrors the federal requirement. So that's a literal mirror to what's required by the federal statutes to use the federal funding in this situation. So we have the agency representatives on again as well if you have any questions for them, but this is not changing anything about the way that the program should work. We're just kind of getting rid of a situation, and to be very frank, this is mostly a problem in Clark County, the way that the systems are interpreting the statutes, but we're having a lot of conversations when all stakeholders agree in the child's life. Guardianship is in the best interest of the child, is the most appropriate placement. Let's move forward with guardianship. We're having trouble getting that funding in some cases just around a legal impossibility question. Is it legally impossible that in 10 years someone might prefer to adopt this child and do what's in the best interest today? So we're just trying to work through that statute a little bit.
Okay. I'll turn it over to the committee. Does anybody have questions on this bill? No. All right. I do not believe we have any questions on this bill. Right. We'll go ahead and is there anybody on the line who would like to testify in support? Ms. Duffy?
Yes, good afternoon again, Chair Ratty and members of the committee. I am Bridget Duffy from the Clark County District Attorney's Office, appearing on behalf of the Department of Family Services, and again, it is BRIGID DUFFY. I'd like to thank the Interim Committee on Child Welfare and Juvenile Justice and the Legal Aid representatives for bringing forth SB 158 and for working with the child welfare agencies to come to an agreement on the amendments that align us with federal language and will not impact our federal funding. It is very important, I was told by my county, that I ensure to you that the Clark County can remove its fiscal note if the proposed amendment is accepted. The proposed amendment changes the original language drafted that was restrictive, and the proposed amendment will move us to federally approved language that will open up kin gap guardianship for more children and families and not impact funding to the state of Nevada. Thank you very much for the opportunity to testify today in support of this bill.
Thank you, Ms. Duffy. We always like to hear when a fiscal note's been removed. Anybody else who is on the call that needs to testify in support of this bill? All right, seeing none, BPS, would you go ahead and open up the call line for testimony in support of SB 158? And again, we'll limit it to 3 minutes.
Thank you, Chair. Callers, if you'd like to testify in support of Senate Bill 158, please press *9 now to enter the queue. Will the caller with the last 3 digits of 988 please slowly state and spell your name for the record? You'll have 3 minutes and may begin now.
For the record, my name is Dr. Allison Caliendo, spelled ALISON CALIENDO, Representing Foster Kinship, I am the founder and executive director. Foster Kinship provides services to kinship families across Nevada as the statewide Kinship Navigator program. We support the bill with the proposed amendment because it provides a minor correction of the NRS to be in line with the federal statute, which will allow child welfare agencies to more appropriately utilize KinGAP as a permanency option for children to exit foster care to their kinship caregiver who maybe does not want adoption but is willing to be the permanent home for the child, therefore providing access to more support for the child post-foster care case closure. I've also provided a more thorough explanation in my letter of support submitted to the committee secretary. Thank you very much.
Thank you.
All right, will the caller with the last 3 digits of 377 please slowly state and spell your name for the record? You'll have 3 minutes and may begin now.
Good afternoon, Deshaun Jackson, DASHUN, JACKSON, with the Children's Advocacy Alliance. Again, I stand in support, the Children's Advocacy Alliance stands in support of Senate Bill 158. We believe that this bill would provide the supports that foster kinship families need and would help with retaining kinship families. Thank you so much, committee.
Thank you.
Okay, will the caller with the last 3 digits of 318 please slowly state and spell your name for the record? You'll have 3 minutes and may begin now.
Good afternoon, Chair Ratty. This is Kendra with the Washoe County Public Defender's Office. That's Kendra Bertschy, KendraBertschy. I want to thank the sponsors and the interim committee for working so hard on this legislation. We believe that the kinship guardianship program is an important piece of the dependency process. We appreciate the hard work to expand this program in order to help more families. These families are those who are already taking in their relatives in order to provide them with a better future. And the more we can do to help them and those children, the better Nevada will be. Thank you.
Thank you. Next caller.
Chair, at this time, there are no more callers wishing to give testimony in support of Senate Bill 158.
Anybody on the Zoom call that needs to testify in opposition? Not seeing any. BPS, if we could open up the line for opposition to SB 158.
Absolutely, Chair. Callers, if you'd like to testify in opposition to Senate Bill 158, please press *9 now to enter the queue. Chair, at this time, it appears no callers wish to testify in opposition to the bill.
Okay. Is there anybody on the call that needs, on the Zoom call that needs to testify in neutral? Looks like we have DCFS.
Thank you, Chair Ratty and the Committee on Health and Human Services. Catherine Roos, Deputy Administrator at DCFS, KATHRYNROOSE. I'm here in a neutral position to thank the sponsors for bringing attention to this issue and working to support kin guardians. DCFS submitted a fiscal note based on the original version of this bill, and I just want to get on the record that we will remove it with the amended language. We look forward to continuing to work with the bill sponsors to see this important legislation through.
Thank you. Anybody else who would like to testify in neutral? Let's go ahead and open up the call line, BPS, sorry, to see if there's anybody who would like to testify in neutral.
No worries, Chair. Thank you. Callers, if you'd like to testify in a neutral position for Senate Bill 158, please press star 9 now. Chair, at this time, it appears no callers are wishing to give testimony in the neutral position for the bill.
Okay, so I'll go ahead and bring it back to the committee sponsor, Senator Orenshaw. Do you have any additional comments you'd like to make?
Chair Ratty, members of the committee, thank you for hearing Senate Bill 158. I want to thank Ms. Bortolin and Mr. Hirsch, Administrator Armstrong, Ms. Duffy, all the other stakeholders worked together on this bill. I do believe this bill would be positive for the state and for our children that are under that jurisdiction. I hope the committee consider processing it. Thank you for your time.
Thank you. And one last shot for the committee. Any clarifying questions that anybody had outstanding? All right, we'll go ahead and close the hearing on SB 158. Again, thank you, Senator Orenshaw, for your personal bill and for representing the interim committee. We appreciate your time with us here at the committee today. With that, we are going to go ahead and open up the public comment. BPS, if you could open up public comment and limit it to 2 minutes, please.
Thank you, Chair. Callers, if you'd like to if you'd like to give public comment, please press star 9 now. Once again, to give public comment, please press star 9 now. Chair, at this time, there are no callers wishing to give public comment.
Thank you. All right, for the chair and for everybody else's information, our next scheduled meeting would be on the 16th of March, and we are going to cancel that meeting, but we will be meeting again on the 18th. So I look forward to seeing you all a week from today. Enjoy your weekend, and thank you, everybody, for your participation today. This meeting is adjourned.